Hey everybody, it's a pleasure for us to be here at the Going Digital Behavioral Health Tech Conference. I'm Jessica DaMassa. I'm the host and executive producer of WTF Health, and I'm here with this guy.
I am Matthew Holt. I founded Health 2.0. I run the healthcare blog, and I do all the startup advisory work. And why are we here again, Jess?
Because we are going to provide an exhaustive, thorough, long, and boring overview of all of the different mental health tech companies that closed funding deals, and we're going to talk about what is happening in the space.
That sounds absolutely fascinating. Is anybody still awake?
Doesn't it?
But hang on. Don't we do something else as well in this space?
We do. Do you mean our cute little 2-minute question and answer show, Health in 2.00?
You mean that Health in 2.00?
That Health in 2.00.
Where you ask questions and I answer them in only
2 minutes? Yes. Why don't we just do that instead of boring everybody with a tedious overview of all of this stuff? I'll just ask you about the biggest fundraising deals in mental health. What's going on in the space? 2 minutes, we're in and we're out. Done.
2 minutes on the clock.
Timer,
ready,
Mr.
steady,
Holt.
go.
Go. All right. Headspace in February closed a $93 million round. What was this all about?
Okay, Headspace, the meditation app to make you relaxed and zen, founded by the Brits, just like Calm, their big competitor, the country which brought you colonialism and world wars.
Now also brings you meditation. Fantastic.
Fantastic.
Right.
They're using some of that money to, they want to get into the sort of the more healthy spaces in DDC up to now.
All right. What about Lyra Health? This closed a $75 million round in March.
Okay.
This is a pretty big deal.
Founded by Venrock a while back, the guy who I think was at AOL some stage. My former colleague, Connie Chen, is now the chief medical officer there. Got to tell you, they're interesting. They claim to be the sort of access to the better cut of psychiatrists, aimed predominantly at employers, one of the big independent mental health only providers.
Okay. What about Mindstrong? This just closed a $100 million round in May.
All right, interesting. Got a guy from Uber to come over and be the CEO. General Catalyst and some others were in this big round. They've got a sort of way that they can tell, just like Ginger.io started with, but doesn't do anymore, by the way you use your cell phone and your keyboard, how ill/problematic/whatever is your condition. It's a lot of biometrics coming out of that. Interesting.
All right, what about Kaiser? They just had a couple of big deals that they announced. Calm and Livongo's MyStrength. They've rolled out to their entire populations.
You actually talked to them a little while about that. But what they're basically up to is fleshing out stuff that goes around and about their current provision of mental health services by their in-house psychologists and psychiatrists. By the way, they had some issues there over the years, and they also use Ginger as well as a backup for that.
All right, this was massive. $1.2 billion for LifeStance.
Yeah, this is a private equity deal. I mean, TPG, one of the big private equity companies, is in this, basically putting together a whole bunch of psychologists, psychiatrists, and making a big provider organization.
All right, what about Meru Health? They raised $8 million. They had some big news too on
that's our 2 minutes.
I asked the question. So for those who don't follow our show,
what?
As long as I know, right? Who could not
be following our show?
The 10 people that are. So if I start the question and the timer goes off, he has to answer the question. And this is usually where things go totally wonky and we end up on like a 4-minute rant. So settle in because this is going to take a second. Meru Health.
Meru Health, run by some lovely Finnish people. Christian Ranter is the CEO there. Very interesting. They started off, their first client was Palo Alto Medical Foundation. They went to try and sell them the idea of, could they use this for their patients? Who did they end up using it first for? It was all those doctors suffering from burnout. So it's a standard mental health, both a bit of CBT, a bit of therapy, a bit of coaching, all the kind of stuff that we see more in this online space. Very interesting that they then have added some other stuff, including some biometrics. You can clip a thing to your ear, which will record your heart rate variation, and you can do your stress management. There have been some people doing that in the space as well. There's a company called Mightier, which does something like that for kids, where you put a wristband on the kid and it's supposed to do that. We bought it for our kids.
And?
only thing that works is shouting and violence, but we'll see.
I'm sure that doesn't
But
work.
Mary is very interesting, and they've been growing, small but growing fast, and I watch this space.
Cigna rolled them out too, right?
Yeah, Cigna rolled them out, but they also did with Talkspace, who are kind of one of the big direct-to-consumer giants as well. So it's interesting to figure out, as the whole mental health evolves. There are, though, I think, we were talking about the folks at What If Ventures have found over 1,000 companies in this space. So we've just told you about a few in 2 minutes, but, that's probably enough for this audience, isn't it?
Totally. We basically hit the high points. What else do they need to know? This is what Solomon invited us here for. So we're done. We delivered. I think we're out, right?
I'm leaving. Bye. Good to see you.
All right. No. Get back here. We promised her like 28 more minutes than just this.
Well, perhaps we should go and prepare something.
Perhaps we should. We'll be back. Hang on to the edge of your seat, folks, because we're going to come back and explain just a little bit more about what's happening in mental health tech. Yeah?
More than 2.0, in 28.00.
Yeah, exactly.
Something like that. All right, so we're back, and we're going to talk about money and funding. This is some data on total health tech funding. Rock Health said it was $7 billion and change last year. Startup said it was 13.7. And this year, if you notice, Q1 was up quite a bit. This is pre-COVID, and probably actually since COVID, it's equally up. I don't know. Doesn't seem to have slowed down. Jess, you found some mental health funding here.
I did. We looked at What If Ventures and CB Insights. So the lower end of the range, those numbers there for 2019 and for Q1 of 2020 belong to What If Ventures. And then the overly optimistic higher end of that range is what came out of CB Insights. But I think what's interesting here, if you look at it, Matthew, is like the amount of funding that was raised in Q1 only of 2020 is about half of what was raised in all of 2019. And that is not even taking into account a lot of the big deals that we've seen in the months after March when COVID really took hold.
Right, and more like 10% of the overall, in fact, more than 10% of the overall, even the high number of startup health. One reason for that has been this last April, nearly a third of Americans claimed that they reported symptoms of anxiety or depression compared to just about, around 10% last year. I can't possibly imagine why.
Oh my God, Matthew, you know that this is because of a global pandemic. And what this is going to end up doing, like we said, we've already seen a lot of fundraising deals close in Q2, and we're just going to see more of that as time goes on here, especially now in light of other things that have happened with some of the protests and around George Floyd's death and things like that, as our country starts to deal with more of these issues. The pandemic, a different pandemic around the pandemic we're already experiencing.
Right, and this has already been reflected. A lot of people you've been talking, like at Ginger and elsewhere, saying the massive increase in volume of use, just like there has been in telehealth, generally has been in mental health as well.
Yeah, so an interesting number from Ginger real quick was that most people had reported that COVID, this was before all of the protests and riots and things started happening, but just COVID itself, they had found to be the most stressful point in their career, even more stressful than September 11th and the 2008 financial crisis.
All right. Well, so I think this leads us to a couple of bigger frames that we're going to put around it. And the first one is, I think, about how is technology that we've been using in digital health being used to transform mental health care. So this first slide, stolen from a session you did a couple of weeks ago with Julia Hoffman from Livongo, is really talking about all these different types of technologies which are really being used now, both sort of now, are being used in sort of just coming into use and will be used in the future, which include sort of electronic records, the change in the use of the web, mobile and sensors, and the way that human assisted technology is becoming as well. So you actually had an interesting point about this slide, Jess.
Yeah, what I like about this slide is that Dr. Hoffman, when she presented it, was talking about how over the last 15 years, as these technologies emerged, the technologies have just been layered one on top of the other. So if you look at current and future, all of this stuff is happening concurrently. And so what's going to be interesting to see moving forward is as we start to add new technologies to this, what's going to happen? And will the technologies that are already there start to work together better to create a more seamless experience? Will they be interoperable? All of that stuff as we start moving forward and watching these technologies become integrated.
Yeah, I think one way of thinking about it, and I'm going to have my own chart here, is to say, how do you think about it?
Of course, you need your own chart because you
I
don't
need
like mine. You only like bubbles. Go on.
I love everyone who knows I love bubbles, right? But one way to think about it is the technologies are being used. Are they more automated? On the left here, self-service. Are they more using clinicians? Another way to think about it is are these technologies and the applications more for people who are basically okay but need some wellness, all the way up to people who have more severe illness? And you've got a whole different panoply of technologies on this chart. But I would say that things like meditation and journaling and even the chatbots are more self-service. You're going to have more and more self-service for people who have more and more severe conditions. People like, beyond verbal doing voice, or there's folks like a Mindstrong or Feel doing automated biomarkers and tracking. And then on the right-hand side of this chart is basically what we have more or less today, which is replacing in-person visits with video visits and telehealth. But of course, even some of that is becoming asynchronous and more effective, more efficient. And then you have folks doing things like using clinicians for peer support to make them more efficient in the middle. In fact, a company we know well called Supportive is doing this with master's students in psychology and doing this very effectively. So I think the whole panoply of the way to think about of how you're going to put these technologies across a range of who's using them, how much clinicians are involved, and how severe the conditions they're looking to work on are. And that's one of them, one way of thinking about it. Another way of thinking about it is how things have changed. So you had the photo of this guy. Who's this guy?
We have Sigmund Freud because, so what we're saying here is that tech is starting to disaggregate mental health care. And so what it used to be was that you'd have a basically one-stop shop. It would be your therapist sitting on a couch and they would be meant to treat all different sorts of disorders. They were like a generalist, but in terms of behavioral health. And sure, some would specialize, but overall, like this was the predominant experience. And now what tech has also enabled us to do in terms of not only helping, take things from like, self-service to, full on, clinician and offering some variety in the way that you access care. It's also been able to kind of split off the different kinds of care and in a way make mental health care a little bit more personalized.
You can always personalize it. Certainly as the market is showing us new different types of companies coming up, and we just picked a number of these. For instance, substance abuse is big, and even eating disorders. You'll hear later in the session, I think, from Keep, Christina Saffron at Keep and others. But things around companies doing things around opiate management, that kind of stuff. A whole group for pediatrics with ADHD with the Keeley, or general pediatric anxiety and others with Amelia and others. Of course, I mentioned Mindstrong was going after all some severe mental health conditions, but then you've got the big mass of companies in our space who are kind of in that mainstream depression, anxiety group, including Lyra, Talkspace, Quartet, and a bunch of others. And then you have this all more wellness-focused people, whether it's around sleep, like a Sleepio or a big health fair, or a Headspace or a Calm. And then, of course, you've got other conditions which are very intertwined between mental health and physical conditions. So things like Ouchie, an app for pain, or Oshi, one for IBS and IBD, where the mental health part is very entwined with physical health. And then, of course, you have we'll talk about this later, the bigger platforms for disease management and chronic care management as a whole, where, of course, mental health is a big part. So I think you're going to starting to see this overall disaggregation as people look at mental health for different types of conditions and are building tools around that. And then we have this whole process of how do we get to the patients and what are the ways we're thinking about and what's the go-to-market approach. And Jess, I like bubbles, but you like Venn diagrams.
I do. I like Venn diagrams. Rainbow colored Venn diagrams.
Rainbow.
So, so this is what's interesting to me is that there's and the reason we have a Venn diagram is because there's overlap. So there's three main ways that these digital mental health solutions are going to market. Some of them are going in as part of a platform. So they're being wrapped in or around other digital health applications for other chronic conditions. Matthew had just mentioned Livongo and Omada. We have standalone mental health care companies, and these offer just mental health care. They're basically, that is the hedgehog concept that they have. That is the one thing that they do. And then some of them are going in as digital therapeutics, which is what this DTX category is. And these are digital health solutions that it's like a carve out of the space, whereby they're trying to say that they've gotten a little bit more clinical validation. And they're meant to function more like a prescription drug. So the idea is that in the end, a doctor would prescribe to you a digital therapeutic the same way they would prescribe a regular therapeutic like a pill. Do you want to say anything about DTX, Matthew? Because I know that's your favorite category of digital health right now.
I'm glad that you got in both your love for hedgehogs, which is well known. Anybody wants to check back in Health in 2.0, we actually did an entire Health in 2.0 a couple of years back in a hedgehog cafe.
In Tokyo, let's qualify where we were.
Jess, I believe, was going to smuggle in several hedgehogs into the US and start a hedgehog breeding farm. Then discovered they were illegal in California. Tragic.
Yeah, that puts me onto that.
So DDX, I struggle with the whole concept of a digital therapeutic. A lot of these companies are trying to build things that wrap around a pill and are doing deals with drug companies. Others are trying to replace a pill but get it prescribed. It does seem to me is that they're trying to go down the path of charging more money. But as you pointed out, they're also going down the path of trying to fit it into the way that drugs get prescribed. And there are a whole bunch of compendia and terminologies and payment systems where if you can get it in there. In the end, to me, it strikes me as that we shouldn't be thinking about carving something out as a digital therapeutic, but I'm the only person in the world who seems to think that. Everyone else seems to.
Well, the two key takeaways I think on this slide are this, is that there's some overlap. So some companies are going to market in this, it can be the same company, they're going as a DTX and they're going as a standalone mental health company, or they're going as part of a platform and a DTX. So there's multiple ways that some of these companies are getting into the market. And number two, this is all a bigger issue about infrastructure. Mr. Holt, would you like to talk about infrastructure?
Is it infrastructure week again?
Go on.
Well, I think by infrastructure, what you mean here is that we are, again, haven't really figured out in the US or worldwide how we're building the overall concept of where do you use a digital health solution compared to the standard way that we've been doing care for 10,000 years. And I have a whole concept of flipping the stack, which we're not going to do in this conversation that Indu Savar and I put together at Health 2.0 a couple of years ago. But clearly, we don't yet have the, as you mentioned, interoperability or the payment solutions that make this sort of clear yet. But we are building both the technologies, the tools, and the understanding how to do that. And this is all part of it.
All right, so let's see some of these companies that fall into some of these categories and some of the money that they've raised. So these are some of the standalone specialized mental health companies. And there have been this Mindstrong, they've just raised this $100 million.
Lyra raised, I think, 90 million just earlier this year. And, there's been some large money. Silver Cloud, Ken Cahill needs to get his act together. He's barely raised any money, but they've done pretty well both in the UK and in the US.
And some of these digital therapeutics companies, some of them are focused, as Matthew had mentioned before. Achille has a focus for pediatrics, I believe.
Yeah, ADHD, and they have a thing is in the pipeline for seniors as well, for dementia. Big Health, as you mentioned, is mostly focused on sleep and insomnia.
And Click, I mean, the thing about these two, these have been around for a while, and I think that they're kind of regarded as two of the leading DTX companies. And both of them have had partnerships with different pharmaceutical companies to either, co-develop a digital therapeutic alongside a real therapeutic, or to just replace completely the pill with a digital solution. And some of these deals have fallen apart. So, I mean, we're seeing a lot of movement in this space. I think this is one of those areas where we've had our eye on it for the last year especially, and it will continue to kind of evolve as the category evolves.
All right. And then finally, there are a whole bunch of bigger platform companies. We mentioned obviously Livongo and Teladoc are public. They're both acquired in recent years, more recently Livongo than Teladoc, a mental health play. A lot of rumors, news reports about Optum acquiring Able2, Optum, which is the biggest if you like, platform company which services more employers than anybody else, part of United Health Group, and even Omada bringing in the technology from Lantern after that went out. Jess, I'm about to dump on you here and you won't like it, but tell me the strategy as to how you figure out who you're going to buy in this space.
Okay, so as we were putting this slide together, I just said, it's like we should tell the startups out there that if they want to get acquired by somebody big, they need to look at the bigger company's branding, because apparently you only acquire things that match you. This must be like the strategy for those, for how to spend those dollars. They're like, bring me all of the blue and green ones. I want to see everything in blue and green. That way we don't have to spend a lot of money repainting accent walls in our office space. We can just absorb those people in. This is a cost-cutting measure. I'm certain of it.
Bound to work. I'll tell the investment bankers that's what you do.
Wild series of M&A by Jessica DaMassa right here.
Works out fine. You just have to have lots of different logos available anytime.
Hey.
All right. So that's one area, right? Is that what kind of things have been developed and how those companies building out.
How they're going to market.
Yeah. But the other question is, how are people buying this stuff? How are people receiving it? So you have the patient down at the bottom and all these different other ways. And so let's talk a little about ways that have been done so far. Of course, here's probably the one that's made the biggest fuss, I would think, is direct to consumer in the App Store.
Yeah, you can just go to the App Store and buy this stuff. What we're showing you here is some of the wellness apps, the mental wellness apps that have been downloaded just in April, 10 million downloads. So, some of these are for a fee, some of them are free, and they have a buy-up option to them. And there's a wealth of other apps that are in there that are not just wellness focused, but are actual behavioral health.
I would say Talkspace has probably been the most aggressive to do this strategy where you can pay $100 a month and get direct to consumer.
Even some of the telehealth companies, you can buy your telehealth visit.
That'll help as well, right? But then, of course, the main way that I think that most of the companies have been trying to sell is direct to employers, and so from the employer to their employees. We just pulled a page here from Ginger, working with Sephora, which is, I believe, a makeup company. I'm not a big expert on this.
You believe it's a makeup. You know it's a makeup.
Even I know that.
Oh my God, please.
But anyway, that's like an addition to the EAP, and I think a lot of the companies in this space have grown by going to this. And again, the pitch is that we'll make your employees happier, more productive, and cost less in their other health areas. And then
route for a digital health company.
Sorry, repeat that again.
I said that's a typical route for a digital health company. Absolutely. A lot of them will sell to large self-insured employers to try to get traction first.
But then the main healthcare system. So here's another slide that we stole from that previous presentation.
Yeah, that was a great webinar that was hosted by AHIP and featured Livongo talking about their MyStrength solution being rolled out at Kaiser Permanente. And so this was from Trina Histon from Kaiser Permanente. And this is cool because she was talking about this ecosystem of services that she's been building at Kaiser for their members, which includes a variety of both digital and clinical care. So it's like the idea is that there's something for everybody in this little wheel of services. And it goes from things like self-care all the way through to, the more serious, one-on-one interactions with a clinician.
And they're not the only ones. CVS, the PBM, CVS came out, the PBM part of CVS has put together a whole digital formulary. It's got a couple like CPO and Will in there. And then the providers themselves are doing a lot here. So just to show you what that looks like, we mentioned LifeStance and that Health in 2.0 bit at the start briefly, but it's an attempt to build a big network with on-site and also telehealth services. MedStar.
Mental health, right, Matthew?
Sorry?
LifeStance is strictly mental health.
Yeah, strictly mental health. MedStar, which is a big, hospital chain in the DC area, went almost all telehealth, and you can be using the Bluestream telehealth service with their provisioning engine. Basically, put everything on their telehealth platform, including mental health as well as everything else. So don't expect those guys to get left out. And the startups, we found one which is Tia, which raised about 25 million the other day, and they have seen about 400% increase, even though they're mainly for obstetrics and gynecology aimed at women. They saw about a 400% increase in behavioral health coming over their platform and their telehealth platform as well. So that's just to say that all these players are going to get more and more involved in providers as well, and are not going to leave this to the specialist companies.
Yeah, this is one way to get to patients.
So in other words, you could kind of say that we have both the approach of go-to-market, but also the channels, which are widely varying. and are going to continue to vary because no one's going to give up their quarter, right? You have venture capital coming in on one side, your employers who are still going to stay in the market, and finally you have, of course, the incumbents, whether it be the health plans like an Optum or a Kaiser, or the incumbent provider groups or even the new provider groups are going to want to get involved in this as well. So I think you're going to see all of this continue to grow and be a long while before we sort it all out. Which leads us to what's next and and Jessica, what the hell is going on with this guy?
Well, we just better hope that everything becomes wireless is all I'm trying to say with this graphic here. No, but I mean, I think we can be wrapped up in technology too much, or maybe we're not, who knows, but I think that it merits posing the question, what's next?
All right. So I think, why don't you do what's next?
All right. Well, what's next in the short term? I think we're going to see basically more of the same. We're going to have more demand for different mental health services all along the spectrum, whether it be mental wellness like we've been seeing or even some more serious stuff. Just because we've been in the middle of a mental health crisis in the country for the last couple of years. And then we had this pandemic and now things are where they are today. And I think that this is only going to grow. With more demand, I think we're going to see more investment in this space. Matthew, you and I have talked about, it seems like every deal we talk about now is mental health or telehealth. So if you are a startup, right? I mean, like that's it. It's like that's what's getting funded right now are the businesses that are able to offer those two types of services. And if you can do that together, even better, which leads me to believe that there's going to be more solutions. So some of the companies, some of the startups that are out there that have a digital solution, we might see some pivoting as they start to offer different mental health or behavioral health services, or we might see some new companies just kind of crop up and maybe bring something new to the market. The climate is right for it.
Well, that brings me back down to our big question, which is, will this work? And
will
honestly,
it work?
When we're doing all these, we've got to think about this. We're layering on new technologies and new approaches, and we said there's a big crisis. Is digital health, behavioral health online going to be the solution? There are some issues, right? So you found this article from CNBC.
I did. So I was starting to go dark and start doing some research on, is this working? Is this not working? And there were a couple of interesting things I found, and it's basically the jury's out. And so this Dr. Steven Schuler has edited this cyber guide, PSYber guide, and I'm sure that this is not the first time you're hearing about this today, because this is the definitive resource when it comes to looking at these different digital behavioral health tools. But basically, one of the things that surprised me is that, according to him, of the tens of thousands of mental health apps in the store, only 3% are evidence-based. And this is not just a problem in digital mental health solutions. This is a problem that has plagued digital health, the bigger category, all along, is that some of these things are clinically validated, some of them are not, some of them are based on some real definitive care theory, others are not. So, there's kind of a mixed bag, and there really isn't a lot of regulation that has gone into looking at these apps and making sure that they work. And there really isn't a lot of evidence that's been collected yet, really, because there hasn't been time. These things are new. So a lot of them are undergoing clinical studies. They're trying to scale up the size of their clinical studies, and some of them are done, but they're small. So, we're watching this evolve in real time as people are using them.
Well, the pretty big question I think that we're going to have to consider as we go to the future of online mental health is the three ones I've written up here. First step is, as you add this to the system, it's kind of like when everyone added Uber and Lyft, the number of car service rides went up dramatically. If we add a whole bunch of people who, weren't really getting treated for their pressure or anxiety, are we just adding more costs to the system, or actually doing something about those people and their overall costs? The second is this whole issue which we raised about mental health and physical health. If you have diabetes, does that make you depressed, or is your depression make your diabetes worse? And how do we think about integrating those two? We haven't really thought about doing the mental health part and the physical health in an integrated way. People have been, that's not how treatment is done. But we're starting to hear a lot about that. And if that's going to work, does it integrate? And does it reduce the cost, or are we adding on more technology and more costs for those folks with chronic conditions? And finally, it's the last, big question we haven't got an answer to yet, but the most serious people with the most serious mental health conditions, the things that you see on the street and we have real problems with the highest costs, people like PTSD, schizophrenia, really severe bipolar disorders, that kind of stuff, severe addictions. You're just starting to see digital tools coming in and starting to work for those services, for those areas. Are they going to work? Is it going to be an area that's going to work for the sickest and most expensive people? Again, we don't know, but that's probably an area that we're going to have to look at over there and come back in a couple of years and see. And with that,
things will be fine. It'll all be fine. All you got to do is just
things will be
fine.
Things will be fine in the end. If they're not fine, it's not the end.
Thank you. But it is the end, isn't it? It is the end.
This is the end.
It's the end. All right. Well, thanks so much for joining us and allowing us to take you on a whirlwind tour of health tech as it applies to behavioral health.
I'm Matthew Holt at Baldy Boy. You can find me MatthewHolt.net.
And I'm Jess DaMassa. You can find me at Jessica at WTF.health.
I just want to say congrats to Salome for putting on such a great conference. And we'll see you soon.
Absolutely. Congrats. And thank you so much for having us. We'll see you guys soon.